All right. And hello and welcome to the Front Row Back Row podcast. My name is Dr. Owen Campbell. And as always, my co host is Dr. Brian Wolf. And together we are Physio Growth. Physio Growth is a mastermind group. If you look in the show notes, it has the school group where you can be a part of. We do a weekly Q&A for our members only. And if you want to check us out, our website is physio-growth.com. I can't even get like the normal .com right.
Yeah, just physio-growth.com, bro. Come on, man. You got this.
I know it's going to take another 2 months to get that right. All right, so today we're going to go a little topical. So, as a lot of people know, Brian, I am a cash-based physical therapist. Mostly because I just started. Cash flow needs to be there. My background is in the insurance world, right? My clinics were like at 98% insurance before this, and Brian is his clinics do take insurance, right? So the big news, obviously, in the insurance world is the shooting of the CEO, the United Healthcare CEO. So I do want to start off the show by saying nobody endorses killing. That was terrible. We are absolutely not, I think the guy's name is Luigi, pro Luigi or anything like that. We want to be able to talk a little bit about the feelings behind insurance, right? And this is, if anything, it does bring up, how a patient. I think the guy had like back pain, and there was issues that he was definitely having with his insurance provider, and certain things getting authorized, I believe, was the issue, or all this allegedly it's coming out in court. But talking about like, man, that was a lot of people have different opinions on that. There
I,
was a
I-
lookalike contest in Washington Square. These different things where everybody's all different. So I mean, Brian, what are your thoughts on it? Where you have
you
to deal with
know,
insurance every day.
the first off that I would say is to Owen's point, and look, to play the politically neutral card here, like it's horrible. Guy had kids and like all the things that were coming out that were terrible around it. I mean, listen, you don't want someone to die under these kind of circumstances. Horrible.
Yeah.
Um, but I was talking to my wife about it, and one of the things that I thought was very interesting is when the first thing I said when this guy got murdered was, I was like, I'm sure it's somebody who got screwed over by United Healthcare,
Hmm.
right? Like that, and this guy was just held responsible, whether he was responsible or not, right?
Yeah.
And so the reality of United Healthcare, I think the denial rate is like 34-35%, something crazy like that high. and,
They
and
are
unfortunately,
routinely, at least in PT,
yeah,
they are routinely the worst one in Arizona.
no
They
doubt about it.
reimburse the lowest. They
Yep.
typically block a lot of care. Yeah.
So the reality is, listen, you're going to piss a lot of people off if you're taking their money and not doling it out, and you know what I mean. And then like people are getting jerked around and they're paying for it. So to me, as horrible as it sounds, my first reaction was like, I can understand why all this is going on. The conversation, the backlash, like like the insurance industry is really not well known for not being crooked, right? Like it's not really
Yeah.
well known for like I talked about this with one of my front desk, one of our people who is a billing, and I said, really the biggest issue is even in healthcare and how bad they reimburse, because they don't reimburse well, right? They reimburse probably, like, to give people an idea, like 30% better than Medicaid. So to give you an idea,
Mhm.
like Medicaid, obviously traditionally reimburses one of the lowest, and it's more that the denial rate is so high. So the reality is, imagine, Owen, if you just lived in a world where you submitted the paperwork to an insurance company and they just paid it, no questions asked, right?
Yeah.
In essence, and the process was simple. In essence, there'd be a lot more utilization. But the
Yeah.
problem is the way the insurance companies have set up, and we've all just accepted it, is the fact that, like, they make it really convoluted, really difficult. So we had to outsource it all to somebody. By outsourcing it all to them, they have to go through hoops that we have to jump through as well for authorization and pre-authorization. Then it has to get submitted, and we hope that, and by the way, it's not even like it gets denied in a timely manner. So
Yep.
there's no doubt about it. They try and do the 90 days. Like, they make it a crappy process. And so
Well, and
the reality is, like, you got to really know the system to work the system to make sure you get paid. But that's kind of ridiculous, right? And I remember learning, I learned a lot about the process as I before I went to go into the insurance pay. But I did realize that the difference between the cash and the insurance, like, there's a lot to blame on the insurance companies for this shit. And it doesn't shock me that somebody went, way too far, obviously, but eventually went to go claim someone's life over it.
Well, and this is the hardest part. Like we're not they use this concept in economics called inelastic demand, right? So if I want a water bottle and somebody raises the price of that water bottle to $400,000, then guess what? I'm going to find a cup, right? Well, you can't do that with cancer treatment, right? Like there's only one medication that fixes the type of thing that you have, right? So no matter what the price is, that is going to be the price, right? And that is something that is when you look at the because that's the product, right? And
Yeah.
maybe patients are the product or the farm is a product, whatever's because people's life, death, quality of life is a product. There are going to be huge emotions, right? And if you look at what a lot of these insurance companies internally are saying now, is their culture, their driving force, their battle hymn of the republic is that they are stopping waste in the healthcare system by
Yeah.
denying people who are overusing, right? And then if you look at providers, right, they're saying they're putting, like, just like you said, putting all these roadblocks up so that they have to pay as little as possible.
Yeah.
And, you kind of go back and forth and you say, okay, well, I mean, there is this, and then there is also that. And how many people are fraudulent and how much does that cost? And then how many people are not getting really the care that they want, maybe that they need versus want versus need. So there's a lot of nuance on each side. The hard part is there's going to be cases like this where someone was denied something that they absolutely needed, right? Or felt they
Yeah.
needed, right? And it leads to a very emotional thing. So those are the issues when this comes up, when especially when we're dealing with patients or we're dealing with the insurance companies, is that like we're talking on the phone to someone else who also believes they're doing the most altruistic thing in the world, right?
Yeah.
And they're thinking they're stopping fraud and helping things, right? And it all comes out, but then it comes down to, well, their quarterly earnings were like 55 billion in profit, right? So
Yeah.
like that's where I think the tide turns, and why,
Yeah.
a killing like this becomes not, oh my god, isn't that terrible, from everybody, right? It becomes like, oh well, okay, better,
Yeah.
right?
Well,
And
it
those
becomes
are
that, yeah,
that's why
polarizing
this is a
thing.
weird one.
Yeah. Well, it's not a weird one. Look, murder is wrong. It's that simple, right?
No,
And
I
it's
mean weird
also
one
very
like
illegal.
the response to the
A
murder,
hundred
right?
percent. The answer is like it. You know what happens is because of what you just said about the denial, and they think they're stopping fraud, but they really know what they're doing, right? Like that's where it comes from. It comes from
And
the aspect
that's
of
it, yeah.
he was headed to a meeting of board members to talk about the core. You know what I mean? It's a publicly traded company that's trying to make money, and the reality of it is like when you do these types of jobs, and like the reality is what ends up happening is these CEOs don't have like a ton of security around them. And
No.
so ultimately, like I was convinced it was going to be some sort of person that lost their home or some sort of person that like lost a spouse because of something, right? Like,
Yeah.
this is actually even like a very minor. I haven't read most of that who that about this guy, but
Yeah.
the reality is like when you think about it, like there's so many horror stories that we've heard that
Yeah.
ultimately led to, again, like the
Well,
misgivings of what could happen. Yeah.
there was a famous case against Blue Cross Blue Shield, which is the reason why everyone thinks Canadian healthcare, you're waiting 5 months to get, a Band-Aid. And really, in reality, if you talk to anybody in Canada, they're like, I mean, it's a little bit of a wait, but it's not terrible. And it's
Yeah.
because Blue Cross Blue Shield basically was denying this one person like life-saving care. They ended up dying.
Yeah.
And the way that Blue Cross Blue Shield was trying to protect themselves legally and in the lobbying effort was saying, well, we're trying to make us not Canada. Look how bad socialized medicine is. So, like, there were much bigger, like, there were life and death things that happened and people didn't go
Yeah.
to murder. But, like, these are the types of things that I don't want to say because I don't know other systems, healthcares, and systems, other countries' healthcare systems in general. But, like, it seems to keep happening in the United States, right?
Yes.
And there's a lot of money involved. And like you said, a CEO's main job is to maximize shareholder value, right?
Yeah.
No matter what the company is. So those are, it's just, it's tough, right?
Yeah, man.
It's,
And
but
it's
I agree. The incentives suck, right? The
yeah.
incentives that you need to make money, 4x return, 5x return, 10x return, and the product you sell is people getting medication, right? People
Yeah,
getting
man.
healthcare. That's tough, man. Like I can see that if you're like, you have to sell iPhones. Well, people don't like iPhones. Okay, well, we got to change our product up. Let's do this. You can't change your
Yeah.
product up. like heart surgery, you know?
Yeah.
So
Well, you also could be a CEO that's ethical, right? And thinking that they
yeah,
want to change something in that capacity, right? So like it's also one of those things where if you do have the ability, like here's the one thing I would say about this. That CEO probably had the ability to change certain things, right? That if he
mm,
probably had the idea to be like, we could lower and improve utilization, we could figure out how to decrease, these types of processes. But they were just talking about denying anesthesia and how they should deny anesthesia for
well,
and
you
make
only
that
get it for
something
3 hours, so hopefully
exactly.
your fusion
So
doesn't take more than three.
so
Yeah,
not for nothing, right? Like, and again, this is not a pun intended, but if you're going to be a dick and they're going to do that kind of stuff like to people, it probably does put a bullseye on your back. And what's
yeah,
horrible is obviously some madman, shot at you and did that.
yeah.
So it's like the reality of it is like what I'm actually very curious about, Owen, is do you think there's any actual tangible change that occurs since something like this happens, right? Do insurance companies think,
No,
maybe we've gone too far? Do we change
no.
anything, right? And it's crazy. Your
The
answer is
incentives are
no.
the same.
So here's
Yeah,
the even crazier part, man, that no one's talking about, right?
yeah.
How about the fact that if we're saying no, nothing changes, United Healthcare doesn't change a
No
thing,
chance. Yeah,
that means that a murder of their CEO because somebody was denied healthcare, they're like, just put another CEO in there. So then, are we
yeah. Yep.
talking about some sort of Lex Luthor like type of thing? And not for nothing, guys.
Yeah.
Then that trying to means to a certain degree, like that's craziness. If you don't think again, Owen, think about if we had a big company, right? A big company with hundreds of
Mhm.
employees, thousands of employees, right? And the CEO got murdered, and we all looked and they were like, well, they got murdered because of some bad shit we are doing.
Yeah.
Do you think that
You're talking about a company, I'm talking about an institution.
well,
That's
even but
why I say no, is
but even
that
but then
it
but
is
then here's the
healthcare
thing.
companies are institutions now.
Yeah,
Like,
no,
they're too big to fail.
I
So,
get it,
like
but even still, if you're gonna say that, right, then I understand where people are coming from when they're
uh-huh.
just like totally shitting on this guy's murder, right?
Yeah.
And by the way, I'm not one of these people who's trying to do that. I'm not trying to take to that. But when he first was killed, my first reaction was before anything came out was like, huh, that sucks. But I also understand, like, I'm surprised it didn't happen sooner. Like, this world we live in is crazy.
Yeah.
Like, for this institution to be as jacked up as it is, and as terrible as it is, and terrible to people and human beings. And to your
Yeah.
point, we just said it's a institution that's never going to be changed, even if you start murdering people who work for it.
Yep. Too much
That's
money.
crazy.
Yeah.
That's crazy. So when you think about it, like that's a bad system, guys. That's something that's like again
Well
got to be fixed.
and I mean, it's one of the only probably the only one I can think of off the top of my head outside of, like, a cable company, but even now, like, people just go to Netflix, where, like,
Yeah.
they're if a customer is like, you could conceive a customer being lethally pissed off, right?
Yeah. Literally.
Like, it's the only one,
Yeah.
right? And that's in itself, like you said, it's mind-blowing, but then at the same time, healthcare is 20% of our GDP, right? You have so many people with so much interest in it, not the least of which you and me if we own index funds, right?
Yeah, man. Yeah.
So this is the hardest part about capitalism and healthcare, right? Is that it allows for some amazing breakthroughs, but also on a very human level, it has a very hard time reconciling that.
Yeah, no,
So
I agree. And I mean, listen, at the end of the day, this is not what physiograph usually talks
no, it's
about. We
not.
usually talk about something completely
we will
different.
not.
But
We
I
will not
told
take your
Owen,
time doing
I
this.
told Owen I've had too many patients ask me and talk to me about it, and so I suckered him into it and told me how to talk about it, just because I think it's so topical and crazy.
Oh, I'm sure. I'm sure everybody listening to this has heard about it in the past week from a
Oh, of
patient.
course, and
Yeah.
listen, my personal, I know. Oh, I'm sure too. I can also go out
Yep.
to the family because I have two young kids. I can't imagine those two young kids didn't do anything wrong. They didn't, you know what I mean. So
Yeah.
and so it's just horrible for the family and the loved ones of that person. But the at the end of the day, it's a incredible topic that's going on around in the country. And my take on whenever these horrible tragedies happen is I always hope something good comes out of them.
Yeah.
But I tend to be a little cynical here and agree with you, Owen, that I don't think anything's going to change. I feel like unfortunately a poor guy got murdered. The
Yeah.
question is he some poor guy? And I don't know the
Yeah.
answer to that. But
Well,
nevertheless, it's horrible.
and really, just to kind of put a bow on it, is to just say, like, for people who do listen to this podcast for business advice and all this other stuff, is yeah, it's a deviation, but you got to know who we are and what we think about,
Yeah, for sure.
and I think that it's important that it is something affecting us, right? It's affecting everybody. It's a big conversation, um, and yeah, I mean, we just I think it's important that we share our 2 cents because, as
Yeah.
people who profess to know business, right? Like, you would think we would be, at least a little bit more nuanced on like what his reasonings for what he was doing is. But still, man, healthcare is such a weird market that, and so it's so many incentives that I still don't think I stand off my stance of like nothing will change. I
No,
think
and I agree. And I think kind of to finish it off, I mean, if anybody in physical growth in our mentorship group were to ask us, hey, do you think something's gonna happen? And blah blah, I would say, don't hold your breath and
don't
don't
change it.
adjust and
Yeah,
don't change your business model thinking it will. Right.
yeah,
Like the ultimate aspect is you're in control of your business, you're in control of your life. And the reality is this is not going to impact healthcare, one way or another quickly, where it's going to be something. And if it does impact it, it's something that you're gonna have to adjust to, like in a reactionary sense, not in a. I wouldn't predict it in a way that I'm like, oh, it's gonna make this huge impact. I think it's gonna
yeah,
be. It's a terrible story, and that's why it's in the news, and people will have eyeballs on it. So that's why it's got legs. And that's why it'll continue to be talked about. And it's polarizing. But at the end of the day, I do agree with Owen. I don't think it's going to change a thing. And I think ultimately, you're going to want to continue to operate your business in the same exact way.
yeah. Cool. All right, we put a bow on
Cool,
that.
man.
All right. And yeah, so if anybody wants to check us out, physio-growth.com, give us a holler in the show note or in the comments. We're on YouTube, wherever fine podcasts are sold. All right, my friend. Have a good one.
Nice. See you guys.
See ya.